Hey everyone, Justin Jolene here, and I want to share with you another issue of the Running Specialist Report. And today we're going to talk about some emerging research that came out that specifically said to not increase step rate to reduce impact for runners. Now, this is a goal of a lot of running rehab professionals, people that work with runners quite often, and runners themselves. It is very well known that decreasing stride length reduces the impact on runners. So a lot of runners will do this in various ways. Sometimes what they'll do is they'll go and run with shorter strides, or they'll try to effectively use cues to be able to make this happen. However, as running professionals, it's really important to give these patients and runners really good cues that are effective and able to help them actually achieve this decreased stride length and step length. So what we're going to see with this is an improvement in running economy, reducing injury, and lessening pain. So obviously, this is something really helpful to have in our toolbox. But as I mentioned, some of the new research came out that guided clinicians towards using running cues like run soft, decrease step length. However, cues to increase step rate were not effective, and we didn't see that those actually change and reduce the overall impact on runners. So what are some of the clinical pearls for your clinical practice? Well, decreasing stride length does reduce impact on runners. However, cues to run softly and decrease step length, while proven to decrease stride length, they actually do lose some effectiveness at higher speeds. And also, those cues to increase step rate are not effective. So we want to keep that in mind when we're looking at patients and runners. Now, not all runners need to decrease their step length, and that's important because some runners may have an appropriate step length and are not at risk for a impact-related injury. So again, good candidates to reduce step length are those that are either running inefficiently or not economically, or they have a common diagnosis like a medial tibial stress fracture, patellofemoral pain syndrome, or Achilles tendinopathy and patellar fasciitis. So clinicians should be aware that these are effective cues. However, I put this graph here to take a look and to see how the step length and the cueing can effectively work. So we can see here we have a comfortable pace or a comfortable rate of speed. That's going to be a preferred running speed, and basically we can see normal numbers for that. Now, when there was cues to give a decreased amount of step length, we can see that effectively change here. And I'm showing you here this box right here. -8% or 8 on the change, -9% change for the soft cue or run softly cue. However, we see step rate cues were not as effective, -2 here. Now, go ahead and put that at a moderate pace. Now, we still see that they work a little bit. It's just not effective. So again, the step length cue, 5% change, -5. The run softly cue, -7. And then step rate cueing was at +3. So that is going to create more impact. And impact can be calculated by not only the cumulative impact, but also the impact with each stride. So it's important to remember that. Now, as we mentioned before, comfortable running pace, 11 out of 20 on the 15-point Borg scale. And that's going to be fairly light, able to maintain a conversation without getting out of breath while running. Also, moderate run pace is going to be a 16 out of 20 on the 15-point Borg scale. It's going to be hard, labored breathing, challenging and uncomfortable, but sustainable for 30 minutes to 60 minutes. Now, even with effective cueing, we want to be careful because variables can arise. There's different patient populations and there's different patient presentations. And obviously, the practitioner execution of gait retraining is very variable. So I want to pause here to say, even if you have an effective cue, it doesn't necessarily mean that person is going to be effectively changing their overall impact while they're running. So, as much of the research has shown over the past decade, certainly running gait retraining is highly successful over multiple feedback sessions. That's really important. And we're showing that those feedback sessions are getting faded out over 8 sessions and over a total 2-week period. So as they phase out those different cues, then the runners can start to use them on their own and get proficient at it, so they don't have to have someone continually reminding them. This is a good example of when you're seeing a patient, you can have them come for follow-ups to make sure they are running appropriately and running the right way. Now, examples of good cues are going to be verbal cues, visual cues, audio cues, haptic cues, or feedback, touching feedback. But for specifically runners to decrease stride length, it's going to be most to least effective with run softly and lightly, which is the verbal cue, run with shorter steps, ensuring a foot landing position under the body, another verbal cue, or increase preferred step rate by 7.5%, which is an audible cue provided with a metronome. Now, again, those were most effective to least effective. The run softly and lightly cue is your gold standard. That's going to be the best thing to reduce your overall step length and stride length. Now, also, it's important to know that there's other musculoskeletal impacts of changing your biomechanics, and that is going to be important, especially at joint angles at the ankle, knee, hip, and trunk. So specifically for decreasing stride length, we want to think about the we want to think about the plantar flexion angle, especially at initial contact. Now, when you're running, you're going to have a more plantar flexed angle. So this is going to cause a decrease in tibial acceleration. We talked about that overall impact. However, think about what that does for the patient. Well, this is going to increase the load at the Achilles tendon, the gastrocnemius, the soleus. Those muscles are all going to work harder. Also, the ankle joint itself, both the subtalar and the talocrural joints, are all going to be activated more because you're putting more stress in that system. So if there is a patient that has a problem in the plantar flexors, this might be something you want to consider. Also, with these patients, if you're all of a sudden going to have them run more plantar flexed, then we're obviously going to see that you should strengthen those plantar flexors and potentially reduce mileage to mitigate the risk to injury. So we can't just ask someone to change their running and then not do anything about it. We need to help them get there with a successful plan of care. We're going to strengthen your plantar flexors. We're going to ramp you back up on mileage. And here's a good picture to show those differences. Now, really, changing running gait is multifactorial. We want to think about how to successfully decrease stride length. We also want to reduce the overall impact on runners, and the most effective cues are going to be run softly and decrease step length while running. However, we should also be very careful not to overly stress other structures when we do change running gait. And so we want to successfully transition by being able to accommodate with better strengthening at different musculature, especially the plantar flexors, and potentially reduce running mileage. If you'd like to learn more about this, there's certainly more research you can dive into, especially some of the latest research on the effective change on running step rate and injury and the biomechanics. Here's the references. If you have any questions, let us know. And until next time, take care.